So knowing what to ask is extremely important. Knowing how to evaluate the response is another story. As far as establishing baseline, and the reason that it is so incredibly important to establish baseline is obvious. We want to know where we began, why this has not been a priority as far as HRT is concerned, and going only by anecdotal symptoms has probably not helped HRT as far as the success rates and the tens of millions of people that have been on this. Blood, urine, and stool test. What we want to look at are all the specific contributing factors that could possibly be causing the core deficit or the irritation on the greatest level. When we look at salivary hormones, we're going to be able to assess the glucocorticoids, the androgens, the estrogens, progesterone. But there are certain aspects as far as toxicity that we can go further and look at. Hypercoagulation, all of these things, by the way, there are findings in the salivary hormones that will give you an indication if you should go look for hypercoagulation, if you should go look for heavy metals or toxicity. If there are parasites, overgrowth, bacterial overgrowth, or diminished seroimmunoglobulin as far as the intestines are concerned. All of these things give a very specific, clear pattern that's different from other factors. So the cortisol and DHEA can tell you a lot if you know what you're looking at. Some of the in-house testing that can be done is on a regular basis. pH testing of the saliva and urine, the pupillary response, heart rate variability, and CVS, contrast visual screening. Anybody aware of what CVS is? It is a visual acuity test that's been around 50 years that within the last 10 years we realized is a great way of determining if there are neurotoxins present because it changes visual acuity. There are certain parameters, and these are not the typical eye charts that you would normally see. Most of them are lines, and what you're trying to do is to determine which portions of the brain are dysfunctional. And so CVS is something that can easily be done either in your office or over the internet. And there are several sites. Pat Kane set up one not too long ago that I believe they charge $10 for a CVS test. And it's done on the internet. It only takes a few minutes, and they give you instantaneous results and suggest if in fact they're finding neurological disruption as it relates to some kind of neurotoxin. So it's a neat way of doing this without being invasive. Of course, this is how most allopathic hormonal prescribing is done. All right, forget it. We just had a break. Nobody move. Clinical observation. Later, extremely early. Oh, how do you determine an adrenal patient? They're either late to their appointment or they show up 2 days in advance. They're always in a hurry. It doesn't matter. Yet, they're always fatigued. Pupillary response shows poor adaptation with initial constriction with poor tone and dilation within 5 seconds. As soon as we finish this slide, we're going to start looking at pupillary reaction because it tells you a lot. You know, you're going to be the poster child, I can tell. So it gives you an insight instantaneously, and it gives you a tool not only to monitor with, but for the patient to monitor with because you involve them. You show them how this works. They take a flashlight and they go home and they practice in the mirror. And every time they come back to you, they're going to tell you something about their eyes. It'll have nothing to do with endocrinology, but they'll tell you something about their eyes. But it's a neat way of getting them involved with a non-invasive approach, and at the same time being able to monitor, because as they make adrenal progress, the pupillary reactions are going to change, and they're going to change fairly dramatically. Ragland's effect reveals a mild drop in systolic pressure, indicative of poor vasoconstrictive control. What's Ragland's effect? Taking a blood pressure from a supine to a standing position. This is a way of looking, we talked earlier about the systolic pressure actually dropping with an adrenal patient. Ragland's effect is actually, Ragland developed that test, and so we call it Ragland's effect. It's also referred to as an orthostatic examination, looking at how the body acclimates to gravity. This can be done with the BP cuff. You put them into a supine position, you take a blood pressure, you stand them up as you start to reinflate, and you take the next reading with them in a standing position. Chances are you're going to see the systolic pressure drop by about 10 points. If it's more severe. If it's less severe. But you will see that the blood pressure is dropping. HRV is a way of using the computer to calculate exactly what's taking place and to see it as it's occurring. And heart sounds. And this is an amazing thing. When you listen to various aspects of heart function, it will tell you, the heart will actually communicate with you and tell you what's going on. Heart sounds over the pulmonary valve will reveal, when you're listening over the pulmonary valve, if you get a longer or an equal or longer second sound, you're dealing with an adrenal deficit. If it's over the tricuspid valve, it's toxicity, liver toxicity. So just by listening to the heart, you can get a pretty good idea of where you're going to focus your attention with these people. Spinal torque, elevated shoulder, fixed pelvis, anxious, feet turned out or in, supine, pronate, tendency to lean on objects, heels worn on the outside, palpable pain. Okay. At this moment, I want you to take off a shoe and turn it around and take a look at your heel. Now, look, you're going to look this way. New shoes don't work too good, but they do work. You look at the heel wear. Where is the heel worn?
Here.
On the outside. Yeah, you walk in pronate. All adrenal patients walk pronate. They will wear the outside of the heels first. Some of your patients will tell you, oh yeah, every 3 months I have to have new heels. I have seen patients come in where the heels were non-existent. They were so adrenaled out, they didn't even care. They walk pronate. It's the second position in ballet. They will start walking like a duck. The more turned out the feet, the more hypoadrenal that they are. The more hyperadrenal, the more the toes are turned in. As the adrenals give out, there are 5 directly associated muscles involved with the adrenal glands, which is probably the next slide. When these weaken as a result of an adrenal dysfunction, it causes those muscles that would hold the foot forward. It loses the integrity and there's nothing to secure it, and the feet turn out. The longer that the problem exists, the more the feet will be turned out and the more they will have acclimated to it. Now, when that occurs, the feet are the foundation, so it's going to affect all of the structure. So what's the next logical area that's going to be affected? The pelvis, absolutely, and the tail. We all have a tail, just like any other mammal, except ours doesn't extend. It doesn't have to protrude because we have a curvature of the cervical spine for balance. A dog's neck is straight, so the dog needs a tail in order to compensate for balance. Now, when you yell at a dog, what does it do with its tail? When the dog's happy, what does it do with its tail? Wags its tail, right? And you yell at it, it puts it between its legs. Humans do the same thing. When you see somebody walk, and they're walking along, and they're knocking stuff over as they walk, are they a happy person, or are they a sad person? Chances are they're a happy person. But what about the person whose rear end doesn't move? Are they a happy person, or are they anal retentive?